Namaste. Leave no one behind. By member countries falling short of delivering the sustainable development goals they were committed to, they have, once again, denied the most basic human rights to their citizens, which are unfettered access to clean drinking water and a decent level of hygienic conditions in which to live. With almost 50% of the world's population below the poverty line, at varying levels of hunger and starvation, unemployed and incomeless, remain unfortunate to have little or no access to potable drinking water, hygienic living conditions, and proper sanitation facilities. It's not just the respective governments that have let humanity down, but the global haves are now so insensitive that they would rather ignore the majority of Earth's inhabitants and let them perish of thirst and hunger. 79 years after World War II, the human population continues to be exploited to serve wealthy individuals, corporations, and governments. As discussed earlier in this presentation, the population's health has not improved across the globe, although a few examples that can be considered successes are tossed around like one would a hot potato. Efforts made to improve the health of the global population are skewed and biased to benefit the wealthy by continuing to keep the labor force just healthy enough to keep their products available in the market, while the less fortunate continue to seek alternatives as access to health services and affordability rapidly decline. Yes, the situation is as bad as that. The UN, which is tracking the SDGs, suggests countries rededicate themselves to improving the health of their people and food availability, realizing the motivational benefits of such rededication while knowing the enormous challenges faced by most developing countries is just marking the starting line, let alone follow through with the good intentions. The information on both health and food production and its utilization is more than just shocking when considering the technological innovations developed over the 75 years since World War II that could change people's access to health services and improve farming practices, food availability, and the quality of life. It is heartbreaking to even play with children who you know have the slimmest chance of surviving the season from starvation, disease, neglect, or abuse in countries and communities whose lives hang by a thread. The increasingly deplorable state of the health sector across the globe is neither universal, modern, affordable, or accessible to the billions who need health support. The cost of universalizing healthcare infrastructure and staffing hospitals and health centers with qualified and experienced staff, equipment, and medicines has always been so investment heavy, making health a slow return on investment, although an essential one, with many countries trying to offer free services for even the substandard healthcare services they offer. Producing food for the billions has not been managed effectively, although many institutions across the globe have been wasting public funds on trying to do just that. After the Norman Borlaug intervention that led to the Green Revolution, there has been no effective global strategy that ensures food on every table. Leading management experts and agricultural scientists reiterate that while there is adequate food produced to feed the global population, its distribution is based on affordability, which puts poor countries at a disadvantage due to their poor purchasing power. However, they have not yet been able to decrease the wastage incurred between harvest and storage and distribution, which amounts to over 20% of food produced. Millions of tons of food are wasted, which increases the unit cost of foods. And we need not wonder who rakes in the profit for the shortage in food supplies. While member countries achieved less than 10% of their water and health targets, efforts on sanitation were non-starters. It is extremely disappointing to realize the health and well-being of the human population are held to ransom by the nations that have the basic infrastructure to train aspirants to become doctors and nurses, to invent machines and create processes to support the alleviation of health conditions, and the resources to create health centers to effectively cover the population with affordable health services. The basics of food, clothing, and shelter also include services that maintain a healthy and productive population, without which no country can provide the quality of life we all seek. So we need to look beyond hunger and food to the root cause, which takes us to a country's governance and the management of resources required to encourage and maintain a continuing peace that affords time to improve the nation's capacity to effectively improve its efficiencies.